NHA CCMA Practice Test 2026. Question 1. When performing a capillary puncture on an adult patient, which site is choice for the procedure? Option A. The lateral aspect of the heel. Option B. The distal pad of the middle or ring finger. Option C. The tip of the index finger. Option D. The fleshy lobe of the ear. The correct answer is option B. The distal pad of the middle or ring finger. The lateral or medial pads of the middle or ring finger are the standard sites for adult capillary puncture because they have adequate tissue depth and good capillary blood flow. The fingertip is avoided due to greater nerve density and pain. The heel is reserved for neonates. Question 2. A medical assistant notes a prescription for a Schedule II controlled substance. Which of the following is a characteristic of Schedule II drugs? Option A. They have no accepted medical use in the United States. Option B. They have a high potential for abuse but are accepted for medical treatment. Option C. They can be refilled up to 5 times within a 6-month period via phone. Option D. They carry a very low risk of physical or psychological dependence. The correct answer is option B. They have a high potential for abuse but are accepted for medical treatment. Schedule II drugs have a high abuse potential with severe psychological or physical dependence risk, yet are accepted for medical use with strict prescribing controls. Schedule I drugs have no accepted medical use. Schedule II prescriptions cannot be called in by phone or refilled. Question 3. A medical assistant is preparing a patient for a Holter monitor application. Which instruction should be given to the patient? Option A. Avoid taking a bath or shower while wearing the monitor. Option B. Remove the monitor electrodes if they become itchy. Option C. Do not engage in any normal daily activities or walking. Option D. Disconnect the monitor before going to sleep at night. The correct answer is option A. Avoid taking a bath or shower while wearing the monitor. Patients with Holter monitors must avoid water immersion, including bathing and showering, as moisture can damage the device and interfere with the recording. Patients are instructed to continue all normal activities, since the purpose of the monitor is to correlate cardiac rhythms with daily activities. Question 4. A medical assistant notices an administrative error where a colleague changed a patient's chart entry to justify an insurance payout. This action constitutes which of the following? Option A. Malpractice. Option B. Misfeasance. Option C. Fraud. Option D. Assault. The correct answer is option C. Fraud. Deliberately falsifying medical records to obtain payment constitutes healthcare fraud, a federal crime under the False Claims Act. Malpractice involves professional negligence resulting in harm, while misfeasance is the improper performance of a lawful act. Question 5. When communicating clinical details about a patient's condition to another healthcare provider, which structured framework is commonly used? Option A. SPAR, situation, background, assessment, recommendation. Option B. HIPAA guidelines. Option C. SOAP notes formatting. Option D. OSHA safety data sheets. The correct answer is option A. SPAR, situation, background, assessment, recommendation. SPAR is a standardized communication tool used in handoffs and clinical consultations to ensure all essential information is conveyed efficiently and in a logical order. It reduces communication errors and is widely used across healthcare settings, including during transfers and urgent calls. Question 6. A patient with a new diagnosis of type 2 diabetes mellitus tells the medical assistant, "I don't think I can afford my insulin or test strips." To which resource should the assistant refer the patient? Option A. The state's public health department. Option B. A medical social worker or patient navigator. Option C. The local emergency department. Option D. The pharmaceutical manufacturing board. The correct answer is option B. A medical social worker or patient navigator. A medical social worker or patient navigator is trained to identify financial assistance programs, pharmaceutical patient assistance programs, and community resources for patients with medication affordability challenges. The emergency department is not appropriate for financial counseling. Question 7. A medical assistant is selecting a vein in the antecubital fossa for venipuncture. Which vein is considered the first choice due to its size and stability? Option A, basilic vein. Option B, cephalic vein. Option C, median cubital vein. Option D, brachial vein. The correct answer is option C. Median cubital vein. The median cubital vein is the preferred venipuncture site because it is large, well anchored in subcutaneous tissue, and located away from major arteries and nerves. The basilic vein is a secondary choice but lies near the brachial artery, increasing risk of arterial puncture. Question 8. A medical assistant is documenting a laceration located on the anterior distal aspect of the forearm. Where is this injury located? Option A. On the front of the arm, near the wrist. Option B. On the back of the arm, near the elbow. Option C. On the side of the arm, near the armpit. Option D. On the front of the arm, near the shoulder. The correct answer is option A. On the front of the arm, near the wrist. Anterior means the front surface, and distal means farther from the point of attachment, toward the wrist. Together, anterior distal forearm refers to the front of the arm near the wrist. Proximal would indicate closer to the elbow. Question 9. A medical assistant is placing electrodes for a standard 12-lead electrocardiogram, EKG. Where should the electrode for lead V4 be positioned? Option A, 4th intercostal space at the right sternal border. Option B, 4th intercostal space at the left sternal border. Option C, 5th intercostal space at the left midclavicular line. Option D, 5th intercostal space at the left anterior axillary line. The correct answer is option C. 5th intercostal space at the left midclavicular line. V4 is placed at the 5th intercostal space at the midclavicular line on the left side. V1 is at the 4th ICS right sternal border, and V2 is at the 4th ICS left sternal border. Accurate precordial lead placement is critical for detecting ischemia and infarction patterns. Question 10. When coding an office visit encounter, which code set is used to report a provider's diagnostic evaluation and clinical decisions? Option A, CPT codes. Option B, ICD-10-CM codes. Option C, HCPCS Level 2 codes. Option D, modifier codes. The correct answer is option B. ICD-10-CM codes. ICD-10-CM, International Classification of Diseases, 10th revision, clinical modification, codes are used to report diagnoses, conditions, signs, and symptoms. CPT codes describe the services and procedures performed. Both code sets must be included on a complete claim. Question 11. A patient is prescribed an enteric-coated medication. How should the medical assistant instruct the patient to take this medication? Option A, crush the tablet and mix it with applesauce. Option B, dissolve the tablet under the tongue. Option C, swallow the tablet whole with a glass of water. Option D, chew the tablet completely before swallowing. The correct answer is option C. Swallow the tablet whole with a glass of water. Enteric-coated tablets must be swallowed whole because the coating is designed to dissolve in the small intestine, not the stomach. Crushing or chewing destroys the coating, exposing the medication to gastric acid and potentially causing stomach irritation or drug inactivation. Question 12. Which of the following medical abbreviations represents a medication that should be taken 4 times a day? Option A, BID. Option B, TID. Option C, QID. Option D, PRN. The correct answer is option C. QID. QID stands for quarter in die, meaning 4 times a day. BID means twice daily and TID means 3 times daily. PRN means as needed and is not a fixed frequency. Question 13. Which of the following represents an example of positive, therapeutic nonverbal communication? Option A. Crossing arms tightly over the chest while listening. Option B. Maintaining appropriate eye contact and nodding in agreement. Option C. Looking at the clock or checking a smartphone frequently. Option D. Turning your back to the patient while they ask a question. The correct answer is option B. Maintaining appropriate eye contact and nodding in agreement. Maintaining eye contact and affirming nods convey attentiveness, respect, and empathy. Crossed arms signal defensiveness or discomfort, and checking a clock communicates disinterest. Nonverbal cues often carry more impact than verbal messages in clinical communication. Question 14. A medical assistant is speaking with a patient who is angry and shouting about a billing error. Which technique is most effective? Option A. Shout back at the patient to command control of the situation. Option B. Remain calm, use a quiet tone of voice, and listen actively. Option C. Hang up the phone or walk away immediately without speaking. Option D. Tell the patient that their behavior is completely unreasonable. The correct answer is option B. Remain calm, use a quiet tone of voice, and listen actively. De-escalation requires the medical assistant to remain calm, lower their voice, and demonstrate active listening. Matching the patient's volume or dismissing their concerns escalates the situation. Acknowledging the patient's frustration while working toward a solution is the therapeutic approach. Question 15. A patient presents with a pulse rate of 110 beats per minute. Which medical term should the medical assistant use to document this finding? Option A. Bradycardia. Option B. Bradypnea. Option C. Tachycardia. Option D. Tachypnea. The correct answer is option C. Tachycardia. Tachycardia refers to a heart rate greater than 100 beats per minute in adults. Bradycardia is a rate below 60 bpm. Bradypnea and tachypnea refer to abnormally slow and fast respiratory rates, respectively. Question 16. A patient has been diagnosed with a reportable communicable disease, such as tuberculosis. To which agency is the medical office legally required to report this information? Option A. The Centers for Medicare and Medicaid Services, CMS. Option B. The local or state public health department. Option C. The Occupational Safety and Health Administration, OSHA. Option D. The Joint Commission. The correct answer is option B. The local or state public health department. Reportable communicable diseases must be reported to the local or state public health department as required by state law and CDC guidelines. This reporting enables disease surveillance, outbreak investigation, and contact tracing to protect public health. Question 17. Which legal doctrine states that an employer or physician is liable for the negligent actions of their employees performing duties within their scope of work? Option A. Residential ipsa loquitur. Option B. Subpoena duces tecum. Option C. Respondeat superior. Option D. Quid pro quo. The correct answer is option C. Respondeat superior. Respondeat superior, Latin for let the master answer, holds employers legally responsible for torts committed by employees acting within the scope of their employment. This doctrine reinforces the importance of proper training, supervision, and defined scope of practice. Question 18. What angle of insertion should be used when performing a venipuncture with a standard multi-sample needle? Option A 5 to 10 degrees. Option B 15 to 30 degrees. Option C 45 to 60 degrees. Option D 90 degrees. The correct answer is option B. 15 to 30 degrees. Venipuncture is performed at a 15 to 30 degree angle, with the bevel facing up. to allow smooth entry into the vein lumen without passing through the posterior wall. A shallower angle is used for superficial veins, steeper angles risk through puncture. Question 19. While preparing a stool specimen for an occult blood test, which developer chemical is applied to the guaiac paper? Option A, hydrogen peroxide. Option B, acetic acid. Option C, hydrochloric acid. Option D, iodine solution. The correct answer is option A, hydrogen peroxide. Hydrogen peroxide is the developer used in guaiac-based fecal occult blood tests. The peroxidase-like activity of hemoglobin catalyzes the oxidation of guaiac resin by hydrogen peroxide, producing a blue color change that indicates occult blood. Question 20. Which of the following steps is necessary to ensure accurate reimbursement of an insurance claim? Option A, U-coding the service to match a higher billing tier. Option B, ensuring diagnostic codes match the documented clinical findings. Option C, omitting any modifiers that could complicate the process. Option D, billing for services that were scheduled but not performed. The correct answer is option B, ensuring diagnostic codes match the documented clinical findings. Accurate claim submission requires that ICD-10 diagnostic codes precisely reflect the documented clinical findings to establish medical necessity. U-coding and billing for services not performed are forms of insurance fraud with serious legal consequences.